Hello everyone, and welcome back to our channel. Today, we're going to talk about a very important topic: understanding pregnancy. This can be a confusing subject, and having the right information is key to making informed decisions about your health and future. So, let's break it down together in a simple, clear way. First, let's answer the fundamental question: when can a girl become pregnant? It all starts with the menstrual cycle. You might have learned about this in school, but let's do a quick recap. Every month, a girl's body prepares for a potential pregnancy. A key event in this cycle is called ovulation. This is when one of her ovaries releases a tiny egg, also known as an ovum. Ovulation usually happens around the middle of the menstrual cycle. For someone with a regular 28-day cycle, this is typically around day 14. However, it's important to remember that cycles can vary a lot from person to person, and even from month to month. So this is just an average. Now, for a pregnancy to occur, two things need to happen around the time of ovulation. First, there needs to be unprotected sexual intercourse. This means sex without using any form of contraception, like a condom or birth control. During intercourse, sperm from the male partner is released into the vagina. These sperm are incredible swimmers, and their one mission is to find the egg. If intercourse happens during the fertile window, which is the few days leading up to the next step, is called fertilization. This is the moment when one single sperm successfully meets and joins with the egg. It's a microscopic event, but it's the very beginning of a new potential life. Once fertilized, this tiny combined cell starts to divide and grow as it travels down the fallopian tube toward the uterus, or womb. This journey usually takes a few days. The final step for a pregnancy to officially begin is implantation. This is when the fertilized egg, now a small ball of cells, attaches itself to the lining of the uterus. Once implantation is complete, pregnancy is started, and the body begins to produce hormones that support the developing embryo. So, how would someone know if they might be pregnant? The body gives several early signals, though it's good to know that these signs can also be caused by other things. The most well-known and common sign is a missed period. If your period is usually regular and it doesn't arrive on time, it could be a sign of pregnancy. Another classic symptom is nausea, sometimes called morning sickness. Although it can actually happen at any time of day, you might feel queasy or even vomit. Your breasts might also feel sore, tender, or swollen, similar to how they might feel before your period, but often more intense. Feeling unusually tired is another big one. The hormonal changes happening in your body can make you feel completely exhausted, even if you're getting plenty of sleep. You might also notice mood changes, feeling more emotional or irritable than usual. This is also due to the rapid shift in hormones. Another early sign is needing to urinate more frequently. This happens because your body starts producing more blood, and your kidneys have to process extra fluid, which ends up in your bladder. It's important to remember that not everyone experiences all of these symptoms, and some people might not notice any for several weeks. If you suspect you might be pregnant based on these signs, what's the next step? How can you know for sure? The easiest and most private way to check is with a home pregnancy test. You can buy these at any pharmacy or supermarket without a prescription. These tests work by detecting a specific hormone called HCG in your urine, which your body only produces during pregnancy. They are very accurate, especially if you take them after you've missed your period. The instructions are simple to follow, and you'll typically get a result in just a minute or two. For a definitive confirmation, the next step is to see a doctor. A doctor can perform a blood test, which can detect pregnancy even earlier than a urine test and is considered more accurate. A blood test can also measure the exact amount of the pregnancy hormone, which can give the doctor more information. Seeing a doctor is a crucial step, whether the pregnancy is planned or unplanned, as they can provide guidance, support, and essential medical care. Now, let's clear up a common misconception. Pregnancy is a natural biological process, not an illness or a disease. There is no treatment or cure for it, because it is not something that is wrong with your body. It's a state that the female body is designed to be able to go through. However, while pregnancy itself isn't a disease, it's a life-changing event. For anyone who is not ready or does not wish to become pregnant, the good news is that pregnancy is preventable. There are many reliable methods of contraception or birth control available. So, how can pregnancy be prevented? The most common and accessible method is using condoms. There are male condoms, which are worn on the penis, and female condoms, which are placed inside the vagina. Condoms are great because they not only prevent pregnancy by creating a physical barrier that stops sperm from reaching the egg, but they also protect against sexually transmitted infections, or STIs. They are available over the counter and are a very effective option when used correctly every single time you have sex. Another popular method is hormonal birth control, like birth control pills. These pills contain hormones that prevent ovulation, so there's no egg to be fertilized. To be effective, the pill must be taken every single day at around the same time. There are also other hormonal methods that a doctor can provide, such as injections that you get every few months, or a small implant that is placed under the skin of your arm and can last for several years. For a longer-term, reversible option, there's the IUD, or intrauterine device. This is a small, T-shaped device that a doctor places inside the uterus. There are hormonal IUDs and copper IUDs, like the copper T. They are extremely effective and can prevent pregnancy for many years, but they can be removed by a doctor at any time if you decide you want to become pregnant. The most certain way to prevent pregnancy is to avoid unprotected sex, especially during the most fertile days of the menstrual cycle around ovulation. Combining methods, like using a condom along with another form of birth control, can offer even greater protection. Making decisions about sexual health and contraception is a personal journey. If you have questions, it's always best to talk to a trusted adult, like a parente school nurse or a healthcare provider. They can give you personalized advice and help you choose a method that's right for you and your situation. There is no shame in asking for information or help. Being proactive about your health is a sign of maturity and responsibility. Thank you so much for tuning in today. We hope this information was helpful and empowering. Knowledge is power, and understanding your body is the first step toward making healthy choices. If you found this video valuable, please give it a thumbs up and share it with someone who might benefit. Do you want to forget to subscribe to our channel and hit the notification bell so you don't want to miss our future videos? Stay safe, stay informed, and we'll see you in the next one.